Catawba Regional Hospice has developed into a community-based healthcare organization over the last 35 years. We're located in Newton, North Carolina, and we serve 10 counties. We started out in 1979 in a small house that we rented from the First Presbyterian Church. And today we have our Carpenter Hospice Center and our Hickory office downtown. So we have a variety of offices, that back up our 250 employees. In terms of the hospice activity, we serve a little over 300 patients a day. In our Life Transitions program, which is palliative care, we serve about 450 patients a day. Verizon has enabled us to become more efficient. I mean, obviously with the communications and our nurses going in a variety of directions, our social workers, our CNAs traveling to homes to be able to communicate back to the office, to communicate about patients, etc. All of that has helped us tremendously in terms of being way more efficient than we used to be. Used to, you'd use beepers. Well, we don't have to do that anymore.
I think one of the primary ways we use technology is with our nursing assistants, and we use an application called CellTrack, which uses smartphone technology for them to set their schedule every day. It has their care plan for each patient on that phone so that they can do their documentation at the bedside. In the mornings when they come in, a nurse will make sure that their schedule is loaded into their smartphone. Once they look at that, they start obviously with that first patient on the list. They go to that patient. They're able to plug in that address. And when they get to the patient's home, they're able to see exactly what the care plan for that patient is. They're able to check off that as they leave the home, if they gave a bath, if the patient refused a bath, whatever services they were able to give, and then they punch in the next patient, and that address for the next patient is there, and so from there, that's how their day progresses.
What that's done for us is it's allowed them to see more patients a day. And obviously, as in any organization, usually your costs of personnel are the highest. Well, anytime you can manage that in a better number, then you've really done something beneficial for your organization.
And from a patient care perspective, they're not focused on trying to deal with paper and trying to route and map their day. They're able to concentrate on patient care, and it just works for everybody. Our nursing staff and social work staff, and actually even our chaplains out in the field, have access to laptops, and we have an electronic medical record that can be accessed through the wireless network. And we have been able to supply those who are in outlying areas with air cards so that they can get immediate access to that medical record and can document in real time, just as the nursing assistants are documenting in real time. Well, because of the efficiency that the CellTrack program allows us and the smartphone technology through Verizon and through the wireless network, our nursing assistants have been able to see approximately 90 more patients a week, and which is a huge difference for our agency. I think one of the driving forces initially with Verizon was the strength of the network. We cover a 10-county area, and we needed a provider who could be available in all 10 counties. And so that was a driving force in the beginning. And I think what's kept us with Verizon is the customer service. We know that we can get in touch with our rep at any time, and any issues we've had with the technology, we've always been able to find someone at Verizon. And Verizon's always been quick to give us the newest technologies, keep us abreast of what's going on, and we're always looking for new apps and new things to employ, and we know that Verizon will be there with us as we find those.